why your vision is failing, and how to start reversing it today. If in recent months you've needed more light to read, feel glare when driving at night, notice less vibrant colors and end the day with more eye fatigue, know this. It isn't just age. The root problem is energetic, not chronological, and it begins in a tiny point of your retina that rarely gets attention outside the clinic. The cones in the macula, the cells that enable fine detail, daylight vision, and color perception. What is the biggest visual discomfort you feel today? Is it end-of-day fatigue, difficulty reading at night, or that feeling that letters blur after hours in front of the computer? Comment now, because in the next few minutes you will understand why this happens and how to start reversing it naturally this week. What no one tells you, vision requires a lot of energy. The tiny central region of the retina, the macula, especially the fovea, has the highest density of cones in the eye. Each cone is a seeing machine packed with mitochondria, the organelles that make ATP, the cell's energy currency. Over the years, due to oxidative stress, blood sugar spikes, and poor light habits, we lose functional mitochondria. The result is a drop in the ability to distinguish contrast, colors, and fine details, exactly what you need to read comfortably, drive at night, and work at a computer. Think of it like this. Your favorite text at 16 inches is like a delicate concert. If the orchestra of mitochondria is reduced, the music, the image, comes out weak, distorted, and stressful. The internal lens still tries to compensate by contracting to focus, but if energy is low, you overwork the eye muscles and end up exhausted. The 4 silent stages of visual decline. Almost everyone goes through these stages at different speeds. 1. Loss of contrast sensitivity. Shadows blend together, crosswalk lines disappear in drizzle, wet asphalt is confusing, you start to feel the road rather than truly see it. 2. Dependence on light. The same package you used to read at the supermarket now requires a phone flashlight. Newspapers need a strong lamp, and small print becomes uncomfortable even during the day. 3. Glare and halos. Reflections from windows, headlights, and monitors blow out your vision. Driving in rain with headlights in your mirrors becomes tiring and often unsafe. 4. Macular compromise. If energy loss reaches the macula, fine detail disappears. Glasses help, but the cause remains. Too little energy inside the cones. The role of the lens and the focus cramp. The lens should be flexible to adjust focus when switching distances. With many hours of near screens, the ciliary muscles go into sustained contraction, a kind of accommodation cramp. You lift your eyes from the laptop and everything is blurry for a moment. Into dry environments, air conditioning, and incomplete blinking. People at screens blink less and only partially, and the eye protests with burning, heaviness, and tearing. Metabolism and retina, too much sugar, less vision. The retina is a metabolically demanding tissue. When there are glucose spikes, meals rich in flour and sugar, constant snacking, poor sleep, compounds form that glycate proteins and oxidize lipids, exactly the kind of assault that reduces mitochondrial efficiency and stiffens structures. In simple terms, the diet that inflames the body dims your cones. The 14-day reset. Start with what changes vision the most. Before any technology, adjust your environment, your behavior, and your plate. In 2 weeks, most people report less visual fatigue and more reading comfort. 1. Ergonomics and the ocular microenvironment. Monitor height, slightly below eye level. This lets the eyelid cover more of the cornea and reduces tear evaporation. Task lighting. A warm LED, 3000-4000K, aimed at the book or keyboard, not at your face. More light on the target equals less focusing effort. Humidity. If the air is dry, use a small humidifier on the desk. Reflections. Avoid direct light on the monitor. Reposition the lamp to cut glare. 2. The 20-20-20 rule, with a crucial addition. Every 20 minutes, look at an object 20 feet away for 20 seconds. Crucial addition. Perform complete blinks every 5 seconds during that period. This lubricates, resets eyelid opening, and reprograms focus. Finish by alternating your gaze between 20 feet and the horizon for 5 to 10 seconds as if you were using a natural optical zoom. 3. Outdoor focus training, without your phone. Set aside 2 hours a day of long-distance vision. This is not a mindless walk. It is active focus. Hold your gaze for 10 to 15 seconds on a branch, then a sign, then a distant building, then a cloud. Change the target and the distance repeatedly. This training releases the accommodation cramp, challenges the cones with real patterns of light and color, improves depth perception. Tip: if 2 hours seem impossible, break it into 4 30-minute blocks, for example, commute, lunch, late afternoon, and a short evening walk. Light rhythm: morning to switch on, night to wind down. Morning, 5 to 10 minutes of indirect natural light, shade, open sky, balcony. This anchors the body clock and supports deep sleep later, fuel for mitochondria. Night. Reduce intense screens 90 minutes before bed and use warm light directed at what you read. Your brain understands it is time to lower arousal. 5. Macular protective plate, every day. Egg yolk, the most bioavailable form of lutein and zeaxanthin, carotenoids that accumulate in the macula and act as an antioxidant filter. Dark leafy greens, kale, charred spinach, and pistachios, more lutein and zeaxanthin for your reserve. Preformed vitamin A, liver once or twice a week, quality cod liver oil, butter, essential for night vision. Healthy fat on the plate, olive oil, avocado, nuts. Without fat, you do not absorb these nutrients well. Hydrate throughout the day. Dehydration destabilizes the tear film. 6. Stable metabolism without extremes. Cut the spikes, swap flour and sugar for proteins, fibers, and vegetables. Keep a regular eating window, for example 12 to 20 hours, to reduce grazing, stabilize glucose, and start light nighttime autophagy. Sleep, 7 to 8 hours on a similar schedule every day. Without night maintenance, mitochondria run rough. What does this look like in practice? A simple day plan. Morning, natural light for 5 to 10 minutes, plus a protein-rich breakfast, eggs, cheese, fish, and greens or avocado. Work, 20-20-20 with complete blinks, water bottle always nearby, monitor slightly below eye level, lamp aimed at the keyboard. Lunch, half a plate of vegetables, a quarter protein, a quarter smart carbohydrates, legumes, roots, with olive oil on top. Afternoon, a short walk without your phone with long-distance focus for 3 to 5 minutes. Night, light dinner with protein, greens, and healthy fat. Finish 3 hours before bed. Warm light and directed reading. Progress indicators, no purchases required. Light needed to read. Mentally note the brightness you use today. If in 2 weeks you can read with less light, you cleared the first hurdle. Comfort switching distances. Look up from the computer to the window. If blur clears faster, accommodation is unlocking. Night glare. Notice the difference when facing headlights and shop windows. Fewer halos equals better functional contrast. Common questions, direct answers. Does this replace glasses? No. Glasses correct focus. The measures above improve the biological terrain, cone energy, comfort, and contrast. Many people report less dependence on strong light and less fatigue, but lens prescription is a clinical decision. Do I need to stop working at a PC? No. You need to break the cycle of continuous effort. 20-20-20 with complete blinks, task lighting, outdoor focus, and decent sleep. And lubricating drops. They can help symptoms, but they do not replace environment, complete blinking, and ergonomics. If dry eye persists, an eye exam is important. Mistakes that sabotage your vision, and how to fix them today. Intense cool light at night, it stimulates the brain and worsens sleep and eye fatigue. Fix it with warm lamps aimed at the target, not your eyes. Walking while looking at your phone, it does not train long focus. Fix it by choosing distant points and alternating targets. Drinking too little water, unstable tears and burning, fix it with frequent sips and brief breaks. No evening routine. Going to bed late and waking up early drains mitochondria. Fix it with a shutdown ritual of low light, reading, and no screens in the last hour. Low-fat plates, poor carotenoid absorption. Fix it with olive oil, avocado, and nuts. Warning signs, stop and see an eye doctor. Eye pain, curtain-like vision, flashes of light, sudden vision loss, persistent floaters with shadows, eye trauma. Prior diagnoses of glaucoma, macular degeneration, or cataract require follow-up. The strategies in this block are lifestyle and environmental support, not a substitute for treatment. Why this block comes before any advanced technique. When you correct light, focus, sleep, hydration, diet, and ergonomics, you accomplish two essentials. 1. You increase energy available to the cones so mitochondria work without sand in the fuel. 2. You reduce the noise that confuses visual perception, such as glare, dry eye, and accommodation spasm. Only after that is it worth considering additional strategies covered in Block 2, because they potentiate a terrain that is already healthier. It is the difference between forcing an amplifier into an unstable outlet and checking the wiring first. Practical challenge for 14 days. Days 1 to 3, adjust lighting and monitor, set a 20-20-20 reminder. Days 4 to 7, consolidate outdoor focus training on distant targets and stabilize bedtime. Days 8 to 14, optimize meals with daily yolks, greens, olive oil, and fewer flours and sweets. Track night glare and the light needed for reading. If by the end you notice less fatigue, better contrast, and less need for light, you are on the right track. Advanced tools and a 21-day protocol to boost your vision. Now that you understand why vision fails and what happens inside your eyes when the body loses energy, it is time to act. This is the moment to use science in your favor with simple, safe measures grounded in physiology. This is not a magic cure, but a way to reactivate the right cellular environment so your eyes can work as designed. 1. Photobiomodulation, the red light that reactivates mitochondria. Have you heard of red light therapy? This is one of the most fascinating fields in cellular aging research. Recent studies show that safely exposing the eyes to red light around 670 nanometers can improve mitochondrial function in the retina, exactly where vision tends to weaken with age. The explanation is simple. This wavelength stimulates the production of energy ATP inside the mitochondria of the cones, helping restore part of the performance lost over the years. Important safety notes. Not all red light is appropriate, and not every method is safe. Keep eyes closed during exposure. Infrared light crosses the eyelids easily. Keep sessions short, up to 3 minutes, only once per week, preferably in the morning. Use devices rated IEC 62471 exempt or low-risk RG1. If you choose simpler options, look for baby-safe lamps or equipment that specifies 670 nanometers. The effect may last up to 1 week, so daily use is not required. This technique is called photobiomodulation. It does not replace the basics, but it amplifies everything you started in Block 1. Think of it as recharging your visual mitochondria, like putting a charge into the cone's battery. 2. Activating the internal cleanup, fasting and autophagy. The next step is to clear the terrain by removing damaged proteins and toxins that cloud ocular tissues. This is where autophagy comes in, a natural cellular recycling process the body activates during controlled periods without food. During fasting, the body repurposes defective structures, including the floating proteins that cause what we call floaters, those small specks that drift across your field of vision. This cleanup also helps prevent cataract and macular degeneration. How to apply this safely and practically? 1. Start slow. A 12 to 14 hour overnight fast already activates the process. 2. Increase gradually. After 2 weeks, try a 16-hour window, for example dinner at 8 p.m., first meal at 12 p.m. 3. Add an occasional longer fast, 24 to 36 hours only if you are healthy and adapted, and seek medical guidance if you have chronic conditions. 4. Do not break your fast with sugar. Choose protein eggs, fish, plain yogurt, and healthy fat olive oil, avocado. 5. Stay well hydrated with water, chamomile tea, or lemon water without sweeteners. By aligning fasting, sleep, and a natural diet, you create the ideal setting to restore the retina's energy balance. 3. Cataract, reversing the frosted glass with the right habits. Cataract results from lens proteins turning opaque, as if the inner glass of the eye were fogging up. The biggest enemy is excess sugar and starch. When there is surplus glucose in the blood, it binds to proteins and forms advanced glycation products that harden the lens. To stop and in some cases slow this process, reduce sugar and refined flours. Prioritize natural carbohydrates, roots, legumes, whole fruits. Include foods rich in carnosine present in red meat and benfotiamine, a vitamin B1 derivative that helps block glycation. Discuss with your doctor the use of N-acetylcarnosine eye drops, used in studies with encouraging results for clearing the lens. Deep, regular sleep helps as well. Nighttime is when the body performs antioxidant cleanup. Cataract prevention begins at the table and in your sleep, not only in a bottle of drops. 4. Glaucoma. When the problem is pressure and inflammation. Glaucoma is a silent but destructive disease marked by increased pressure inside the eye. Although medical treatment is essential, drops and regular pressure checks, the metabolic terrain matters. Chronic inflammation, insulin resistance, and low antioxidant status worsen intraocular pressure. Support for standard care. Avoid glucose spikes and excess salt. Practice light aerobic exercise to improve ocular blood flow. Sleep well. Short nights and fragmented sleep raise intraocular pressure. Vitamin D, always paired with magnesium and K2, helps balance calcium metabolism and has an anti-inflammatory role. Niacin vitamin B3 appears in some research as a possible coadjuvant for ocular function. Discuss it with your ophthalmologist. The secret is to treat the whole body. The eye is only the tip of the iceberg. 5. Dry eye, a symptom that reveals much more burning, sandy sensation, blurred vision. Dry eye is one of the top complaints in people who spend the day at screens. It is not only a lack of tears, but often an issue in the autonomic nervous system, especially when there is vitamin B1 thiamine deficiency. Coffee, black tea, and high-carbohydrate diets deplete B1, impairing control of the lacrimal glands. To treat both cause and symptom, complete blinking. Shallow blinking does not renew the tear film. Warm compress for 3 to 5 minutes once a day to stimulate the meibomian glands. Humid workspace and monitor positioned slightly below eye level. Replete B1 through foods meat, eggs, seeds, nuts, and reduce caffeine. Healthy fats and omega-3s help the tear's oily layer. If symptoms persist, seek an eye evaluation. Some cases require specific therapies. 6. Precision nutrition for the macula and retina. The macula is the center of detailed vision. Its protection depends on specific nutrients. Lutein and zeaxanthin are antioxidant pigments that filter blue light and protect against macular degeneration. Saffron. Real saffron has studies suggesting improved visual acuity in mild AMD. Polyphenols, such as resveratrol, turmeric, and 70% cocoa, reduce inflammation and glycation. Vitamin A and zinc are cofactors for regenerating rhodopsin, the pigment that enables night vision. Remember, absorbing is more important than ingesting. Without healthy fat and proper digestion, bile flow, and gut health, these nutrients pass right through. 7. A 21-day protocol step-by-step to retrain your vision. Morning 10 to 15 minutes, 5 to 10 minutes of indirect natural light, open sky, no sun staring. 1 focus cycle, alternate 60 to 90 seconds between 20 feet and the horizon, blinking every 5 seconds. Breakfast with protein and healthy fat, eggs, avocado, olive oil. During work. Every 20 minutes, look 20 feet away for 20 seconds. Hydrate, lower the monitor slightly, and use warm lighting. Take 1 2 to 3 minute outdoor break every hour. Afternoon. Short walk with distant focus without your phone. Stretch neck and shoulders to release ocular tension. Snack with protein and fiber nuts, yogurt, eggs. Evening. Avoid intense screens after 9 p.m. Warm light of 3000 to 4000 K directed at your book or keyboard. Light dinner without refined starches. Sleep 7 to 8 hours. Sleep is invisible surgery for your mitochondria. Weekly. 1 short red light session if you choose to use it. 2 servings of fatty fish, natural omega-3. 1 meal with liver or a real vitamin A source. 1 controlled fast 12 to 16 hours on low-demand days. Monthly. 1 longer fast 24 to 36 hours with guidance. Review visual comfort and screen time. Adjust lighting and breaks as you progress. 8. How to measure improvement without expensive tests. Track your own progress with simple indicators. 1. Light tolerance. If you can read comfortably with less light, your contrast is improving. 2. Adaptation time. After looking far away and returning to the screen, if focus locks in faster, accommodation has improved. 3. Eye fatigue. At day's end, check whether your eyes burn less and vision stays sharp. 4. Colors. Notice if greens, blues, and reds look more vivid, a sign of more active cones. Write these observations in a journal. Small wins or major metabolic advances. 9. What to avoid so you do not lose progress. Poor sleep. One bad night can reduce ocular energy for up to 48 hours. Hidden sugar. Bread, pasta, juices, and cereal bars all inflame the retina. Bright white light at night. It blocks melatonin and reduces antioxidants. Prolonged sedentarism. Oxygen from movement is mitochondrial fuel. Random supplementation. Excess fat-soluble vitamins, A, D, E, K, without testing, can accumulate. 10. Call to action. Take back control of your vision. The worst phrase to hear when your vision is declining is, "It is normal with age." It is not. What is common is cumulative neglect of the body. Mitochondria do age, but they also renew when they receive light, rest, nutrients, and proper stimulation. Before looking for miracle solutions, ask yourself, am I giving my body the conditions it needs to repair? If the answer is not yet, this is your moment. This content is educational and does not replace medical evaluation. Visual changes, pain, light flashes, sudden vision loss, moving shadows, or curtain-like effects require immediate ophthalmology care. The practices described here are lifestyle measures that support visual function and reduce metabolic risk factors, and should always be adapted to your individual condition. Support our channel. Find out how in the first pinned comment below.